How about we define surveillance outputs? How you get there is up to the country or province doing the surveillance. So we need more understanding, we need informed stakeholders. So knowledge transfer may be explaining output-based surveillance. So using peer-reviewed methodology to reach agreed outputs. This is using defining surveillance outputs and changing the methodologies and not using prescriptive methodology, and peer reviewing that methodology. So is that peer review driven by policy, commission, or by an independent body? EFSA was an example using their better training for safer food. Member states meet to discuss and standardize methodology through education. And risk assessment approach is a generic method to sort of look at these sort of outputs. So group 2 for the same question talked about looking at the RISKSUR design and website stuff that was presented earlier today. That this would encourage standardization. The same question came up: do we even need standardization? One benefit of standardization is that it does allow comparative studies, but do we need that? Do we need it for the sake of it? How about categorizing surveillance approaches and tailoring surveillance to those categories? Increasing transparency and documentation. Currently reports aren't always published. Standardized output for surveillance, not necessarily approaches. Terminology problems make standardization and comparison difficult between countries. If there is a need to report, then there should be the ability to build a consensus approach. Finding a European way, so trusting member states, sharing data and sharing approaches and kind of maintaining that conversation. And this goes hand in hand with transparency. So then the last question was, how do we define high quality surveillance and how do we define those minimum standards? I'm sure there's lots of overlap between the groups, so apologies if I repeat myself. Group 3, effective spread of the EVA and design tool, training alongside that, linked with legislation and the new animal health law alongside best practice guidelines. A less prescriptive law could impact standardization, so therefore actually reducing standardization across different countries. It's difficult to get harmonization within a country, let alone within the EU, so that's something else we've got to bear in mind. RISKSUR approach encourages standardization with terminology and defining those. So spreading that information out there might help to increase standardization. It isn't necessarily as long as there's transparency for approaches, data and terminology. Surveillance needs aren't necessarily standardized, so why should we standardize surveillance outputs? So standardizing output requirements and the description of those outputs. High quality surveillance requires knowledge transfer both the EU level and training, and transparency and high quality surveillance go hand in hand. But how do we governance transparency? Do we demand it? How do we do it? To peer review accreditation? Is that too bureaucratic? So group 4 asked, what are we standardizing when we're talking about standardizing surveillance? We're talking about standardizing inputs or standardizing outputs. Sometimes it's simpler to standardize the inputs, although performance may be lower. EU legislation currently demands some standardization of surveillance. Why would we promote increased standardization of surveillance? Is it even relevant? Maybe a guideline on what to achieve, and they can decide whether or not to comply. But then we thought about, does this apply to all diseases? I mean, some of the high public impact diseases and the disease epidemiology demand it. High quality surveillance, though, can be done at a local level. It doesn't have to be done at a national or pan-national level. The quality assurance is up to the surveillance body and whoever's paying for it. Does it fit their own requirements? One answer was disseminating success stories can increase practical approaches. So if we get out the things that work and publicize them and market those successful surveillance approaches, we can increase uptake of useful surveillance approaches. Legislation can define the minimum expected standards along with best practice guidelines for high impact diseases. But comparing certain diseases can be useful, e.g. national control plans for salmonella. Being aware of neighbouring country disease statuses and to take into account more output-based guidelines for surveillance. Public availability of data is useful, but not a necessity for high quality surveillance, especially if it's being done at industry level. Group 5 said we would have to agree on some standards, RISKSUR tools and approach to create standards for surveillance design and evaluation. Surveillance systems must be fit for purpose, so standardization would fit for similar circumstances. BSC approach for standardization of input standards. So this is bearing in mind that when the BSE crisis hit, we had to define standards very quickly and make quite prescriptive requirements for surveillance. There's lots of heterogeneity with disease and disease status, but we have to be prepared to change our surveillance approach when the disease status changes. How do we define standardization? There are lots of differences. In the EU, we have minimum requirements for surveillance for many diseases. Standardization is good for data analysis and science, but it's not necessarily good for disease control. Surveillance approach for trade requires some standards and may well help guide some approaches. Transparency would help awareness, transparency of data, approaches and outputs, everything is all needed. And take into account this difference between high impact diseases where lots of the approaches are already defined and I don't say necessarily low impact diseases, but diseases that aren't mandated through legislation where at the moment we don't have much transparency. The final group talked about we would need money for standardization. Do we even need standardization? The approach is different anyway. Problems are different in different areas. We need to define a minimum requirement, then each member state can decide from there. We have minimum design requirements for many named diseases. Should we not standardize for all diseases? Trade can impact minimum requirements. The more transparency of how we go to show trade to third countries can show the trade requirements needed. How do we define high quality surveillance? Animal health legislation coming in can outline the principles of surveillance. This is what you should do, but it's up to you. Another approach suggested was looking at food safety approaches where you outline critical control points in the process and you can define standards and procedures where there are breakdowns. And you can apply that to other areas of surveillance. Ring trials and lab quality show a similar approach, but it's not necessarily limited to intensive approaches, so you can look at dairy farming. All member states could have a website detailing all their surveillance approaches and their surveillance outputs, and every member state should have a defined strategy for how it goes about doing surveillance. Do we want to talk about the last question now? I don't have the actual question to hand. So as we believe one of the obstacles preventing the adoption of new surveillance approaches is the slow translation of research findings into policy. Do you agree? If so, what do you think are the main reasons for this? How do you think this translation of scientific findings into policy and the implementation of surveillance should be improved? We came up with ideas that industry is not necessarily keen to update their surveillance methodologies, but researchers want to increase their impact. So why do we do research if the industry are currently happy with the approach? Researchers need to disseminate and sell their own outputs to policy industry, and this requires better relationships. Economic outputs of surveillance approaches will have improved effects. Theoretical research on, say, syndromic surveillance aren't necessarily useful to farmers/industry, so directing research on policy is vital. Researchers should be able to measure the impact of their work, and impact shouldn't be included in projects from the beginning. There should be a kind of outputs that include impact. Production trade impact will increase uptake of research to policy, and sanitizing from sort of peer-reviewed technical documents to something farmers, vets will read will increase our impact. Just any other points that people want to make? Or there's a lot there.